Subtalar neutral, right? So I have my horseshoe grip. I'm going just distal to the malleoli so that I'm on the talus. And then I'm just going to invert and evert until it feels about equal each side. So you kind of have to play with it a little bit, okay? Dorsiflexion to 0 degrees. And then I'm trying to get my hand out of the way here, but still stabilize his foot, okay? So I'm just using my thumb on the plantar surface of the foot, and my fingers are on top. So I'm gonna hold that pressure so that I can back away, because I wanna look straight down. Look at his forefoot, and if I'm looking straight down and where his great toe is, like if we drew a line, it would be like this. I'm gonna exaggerate, it would be like this, okay? So where his great toe is more proximal than his fifth toe. Okay, so for him it's really more like this, but it's definitely, you can definitely see the line if you look straight down.
Like the heads of the metatarsals there?
Yeah, so I could put a goni here and here, like straight across, and then right there. Dorsiflexes, the fibula glides anteriorly. Okay, posterior roll, anterior glide. And the opposite is true for plantar flexion. Okay, so the fibula is going to glide posteriorly slightly with plantar flexion. Patient finger, I'm going to use from my stabilizing hand, because ideally we don't want our mobilizing hand to have our palpation finger, right? Okay. All right, so I'm stabilizing with my thenar, hypothenar, and then I have my palpating finger over the joint line. Pincer grip over the lateral malleolus to provide that posterior force, okay? I can just provide that pressure just like that. I let her foot stay in just a little bit of plantar flexion. Opposite direction for your anterior glide. You'll have her flip prone. Okay. So one thing with this, it's just a very small amount of motion. If you don't feel like that you're feeling it, one thing I encourage students to do is, so you're going to provide the pressure and then make sure you come all the way off of it before you. Find my medial mal, and if I drop just below that, that should be my talocrural joint. For the talocrural joint, it's plantar flexion, dorsiflexion. So those are the two. So with a posterior glide, that'll be for dorsiflexion, and an anterior glide for plantar flexion. Mobilizing hand, you want as close to the joint surface as possible, okay? So I want that right on the talus, but make sure you're below the malleoli. Okay. My palpating finger is just distal to the medial malleoli, so I'm trying to get right on that joint. The foot's still in a little plantar flexion, and I'm just providing that posterior glide. Palpating fingers are in the same place. Now this one, I'm having to push through the calcaneus to get to the talus, but it's just going to be the same idea, making sure she's still in a little bit of plantar flexion. Okay. So this hand's stabilizing the foot and then palpating. We're going to move on to the subtalar joint. Inversion, eversion, right? Joint line, joint plane here. Where did I say that rotisserie?
Medial heel to
Lateral heel to navicular, right? Like this. And then we're going to rotate around that. With this one, you do use the table for a little bit of stabilization. Okay? Drop just below that lateral malleolus. You'll be on that subtalar joint line. Okay? Find your palpating finger. Make sure the table's not blocking you. And then again, so this isn't a straight medial glide. It's like medial and then into inversion a little bit, just because of that joint plane, okay? Yep, calcaneus. So ideally, I'm stabilizing the talus a bit with the table, and I'm pushing on the calcaneus, because that's a subtalar joint. Do you have a question?
And you're pushing on the posterior portion of the calcaneus?
Mm-hmm. Yeah, like posterior lateral. What does the medial glide improve? Either one, right? We don't know. Our joint plane. Lateral heel to navicular, right? So right in here. So with our palpation finger, we find the medial mal. If we drop just below that, what joint are we on? Talocrural. Okay, so we got to go a little bit farther south, closer to that subtalar tali, a little bit farther inferior. Medial mal, subtalar tali, And then, yep, so I feel it there. I can kind of wiggle, and then I'm going to do that lateral glide, come all the way out of it. Same thing, a little bit of a roll. It's not a strict lateral. The palpating finger is going to be at your joint line, right? So you find that navicular tubercle and then go just a little bit proximal, or a little bit more toward the back of the or toward the calcaneus. But everything else is the same. Use the same kind of horseshoe grip with my hand to stabilize the talus. So I'm at the malleoli, but now I'm dropping just below because I'm trying to get onto the talus. I can do my pincer grip for the navicular. And the navicular is actually pretty big here, okay? You can even follow up that first ray till you get to the little knob on the navicular to know exactly where you are, right? Okay? Get your little pincer grip. And then I'm just going to do a plantar force. So that's kind of going through my thumb. And I'm going to make it easy on you guys. Just pull upward for the anterior. Okay? Anterior, or plantar glide, and then this will be a dorsal glide going up toward the top of the foot. So it just look like this. Okay? Navicular. That motion isn't really going to contribute very much to like you would think it'd be like for like dorsiflexion, plantar flexion, that kind of thing. It's just, so your foot when you come across different surfaces is going to accommodate, so it's just mobility. So you don't have to remember for a particular direction. If it was really stiff, or if I knew that they were immobilized for a while, that would cue me in if I really want to look at, or if just pain in that region, issues with the posterior tip, I would just be curious. Yeah. Now if we want to do the toes, so you could use a wedge, or you can just stabilize because they're a little bit smaller, a little easier to work with. You can just stabilize with your fingers. So I'm going to stabilize the tarsal, right? That makes sense. My other hand's going to be on the phalange, proximal phalange, and then I can just do the same thing. I can just do this one. You don't necessarily need a palpating finger because it's kind of hard to get in there. The distal phalange, right? Yep. And that's going to be the same for all the toes. So that one's easy, okay? So, right, so if I'm doing more of the dorsal glide, that's going to be for extension. And if I do you can see that too. These toes move really well.